Hi everyone to the audience. So I am trying this on YouTube live. We had some technical difficulties earlier, so I apologize for that. So bear with me. The pace is not going to be the same. If you hear the noises, please bear with me. But I thought it would be cool to experiment with it. So this is Luis Plaza from Let's Talk Micro. This is a live episode. I just had a guest that he was here for a few minutes, and that will be on the edited version of this episode. So definitely, as I said before, I did ASM in June, and it was a great experience. I learned so much. I connected with people. I connected with guests, and it was such a positive experience. And I decided to attend ID Week, which is it's the event from the Infectious Diseases Society of America, and I will talk more about that. But it's just there are some good micro lectures that I overall and some great posters, and I got to connect with guests again, and it's coming to an end. But I will definitely recommend that if you get the chance to attend it, please go ahead and do so. It's definitely a very positive experience. So I thought I will start by saying, what is ID Week, and this is from their website. So ID Week is the joint annual meeting of the Infectious Disease Society of America, the Society for Healthcare Epidemiology of America, the HIV Medicine Association, the Pediatric Infectious Diseases Society, and the Society of Infectious Diseases Pharmacists, or SIDP. So this is from their website. So it's a joint effort, and so we get people from all walks. So we have physicians, we have healthcare professionals, we have pharmacists, which is always it's really good when you get to connect with people from other areas, right? You step away from the lab a little bit and learn what happens beyond those results that you do. We go to the lab, we put our results in, we result that susceptibility, we accept that ID, and then what happens, right? Well, we know that there's a huge impact about what we do, and we affect the treatment of the patient based on what we put out there. But hearing all the pharmacists talk about dosages and medications, and seeing the doctors talk about organisms and treatment, so it's really great to see the whole picture. And I always talk about this a lot, but it's such an eye-opening experience. Sometimes we're so busy in the lab that we do our job, we go home, and right, we're all busy, we have families, so it's a complicated issue. But there's so much more. It's such a huge world, and this is all connected. So it's just, I always, if you have the time and you have the funds, definitely check out one of these conferences, whether it's ASM Microbe or ID Week. I definitely recommend it. So I'm just gonna go ahead and use this time to talk about my experiences and what I have liked. And so let's go ahead and start. So first of all, it's similar to ASM Microbe in the sense that there are both huge events. Whereas microbiology, ASM Microbe, it's more towards the microbiologist. So, and this one is, more healthcare professionals, physicians, pharmacists, but they are very large events. However, this one, ID Week, is larger. And from what I have heard, the assistance this year is higher than any year before. And I'm not going to give you numbers right now because I haven't confirmed anything. But I have heard from multiple people saying that it has been a very successful event. So let's go ahead and so as far as that's one of the similarities, they both have sessions, they have posters, people present, their abstracts, they do oral abstracts where, right, they talk about them, they do rapid fire presentations, just like ASM Microbe. But as far as the people, you get more attendance here, it's larger, but you get that atmosphere of a huge event that we're, right, there's this energy, there's so much to do, and there's definitely a lot to do. And if you excuse me 1 second. So a lot of energy. Like I said, some great posters, some great presentations, and so and I keep saying it, but definitely a great experience overall. So those are the similarities with ASM microbe. I mean, they're within the infectious disease. You know, the target demographic for ID week is a little bit different, but pretty similar format. So you stay busy, you have to stay organized, you have to pick and choose what you want because you're gonna consume a lot of time as you are trying to get to what attend some lectures, and but you cannot attend them all. So it's gonna be very difficult. So but overall you just pick the ones that you like the most, and then uh if you like me, I do this podcast and I like to connect with people and try to meet more listeners and meet potential guests. So I do spend a lot of time on the posters, and that's very time consuming. So your days will go by fast, and there are long days. I mean, if you attend everything, you can be in from 8 p.m., 8 a.m., sorry, all the way to 5 p.m. So those are busy days. So at the end, you're tired, but if you're into this, it's definitely very rewarding and very worth it. So now that I have said that and I have compared ASM to ID Week, let me go ahead and start with the talks that I attended that I liked. And if you're registered for ID Week and you're listening to this and you can access the recordings later, please go ahead and do so and check them out. These are the ones that I definitely like the most. So let me start with the talks that I have. That the first one was Mpox, a case study of syndemic response by Dr. Dmitry Daslakis, who served as the deputy coordinator of the White House National Mpox Response, and he currently is serving as the acting director of the National Center for Immunization and Respiratory Diseases at the CDC. And he talked about, did a great presentation on Mpox and about how it affected. He talked about the demographics and people with access to healthcare, and he talked about the disparity sometimes between the race and a lot of good information regarding Mpox. So definitely, if the recording is available, and I am not sure if it is, please go ahead and check it out. And then the second one was the system-wide implementation of a new urine culture to optimize diagnostic stewardship by Lisa Parlich. And she's an infection preventionist and a former and an MLS as well from Northwestern Medicine, Illinois. I had the chance to talk to her after the presentation, and she did it was great. Those of you that work in micro and you work with urine cultures, you know that you have this order, that they order the urinalysis and it reflexes to a culture if it's positive. So basically that algorithm was meant to change that order. So the end result is that the providers have to answer some questions before ordering the urine culture, and it's not ordered as a standalone. I mean, the urinalysis, yes, but not the culture. And that just reduces the number of cultures that are done. And those of you that work in micro, and if the culture is ordered, something grows and you report it, then the patient gets potentially treated, which I'm going to be talking more about that later today. So, and then you're increasing the potential of antimicrobial resistance, right? Patient gets prescribed antibiotics. Maybe it was not necessary for them to get it. And I'm just staying, on the edge of this. I'm not a physician. I don't have that training, and I don't know that part of the picture. So I'm just speaking from what I see from my side. So everything that you report, right? We get this request, please susceptibilities on this organism. And then we go ahead and do them. And then maybe we get a request for more. So we can potentially increase the probabilities of contributing to AMR. So with this order change, this system-wide implementation, it reduces the number of cultures that get order. And I think that this was a great topic, one that really resonated with what I do. So it was great talking to her. And then the next one was, and just to make sure from before, now that I start talking that system-wide implementation of hearing cultures and going down the list, these are oral abstracts, but they were very interesting. So the third one was the efficacy of sulbactam durlobactam compared to colistin against Acinetobacter baumannii calcoaceticus complex, monomicrobial and polymicrobial infections in a phase 3 trial. And this was done by Sarah McLeod, which is a senior director at Innoviva Specialty Therapeutics. So definitely very interesting hearing about that. I don't know if you're too familiar with sulbactam durlobactam, but it was FDA approved, and it's just for for the treatment of Acinetobacter baumannii. So it looks like the results are very good with the drug, and isolates show a great deal of susceptibility towards them. So hearing that comparison, between that and colistin, colistin was a drug that is an older drug that was brought back at some point because there were not that many choices, but it's not good for the patients. Like, it tends to be a little nephrotoxic. So that was a great talk. And then the next one was, how do I determine the likely antibiotic resistant mechanism based on the antibiotic susceptibility profile, and why should I care? And this was by Dr. Michael Satlin from Weill Cornell Medicine. This was a very interesting oral abstract. Thinking about your mechanisms and your profile, and you start thinking, right, things about like ESBL and MC and the importance of these mechanisms and how they correlate to the susceptibilities. It was definitely a very interesting topic. And then the next one was a multi-center observational study to compare the effectiveness of ceftazidime avibactam, which we know as Avicaz, versus ceftolozane tazobactam, which is Cerbaxa, for multi-drug resistant Pseudomonas aeruginosa infections in the United States. And this was done by Dr. Ryan Shields, which is a pharmacist and associate professor of medicine at the University of Pittsburgh. So those talks, they were definitely great. There was another one about the activity of Stenotrophomonas and and ceftazidime. This one was ceftazidime retains in vivo efficacy against strains of Stenotrophomonas multifila, for which traditional testing predicts resistance. And this is by Dr. Matthew Phillips. And this is also very interesting. I don't know if you, they were talking about, they did some testing with ceftazidime, and maybe some might have not been, the susceptibility varied depending. They used like a couple of different methods. So if you register once again and you want to check it out, please go ahead and do so. So after those abstracts, those oral abstracts, I actually got to do something that I enjoy a lot, which is listen to a recording of a podcast. And as you know, those of you that are into microbiology podcasts and infectious diseases and things, Microbe TV, with Vincent Racaniello, and there's a network of podcasts. You have This Week in Microbiology, This Week in Parasitism. There's quite a few of them, and one of them It's called the Infectious Disease Podcast with Dr. Daniel Griffin and Dr. Sarah Dong. Sarah Dong, as you know, she is the host and creator of the Febrile Podcast, a very successful podcast. I had the opportunity to do an episode with her, which is the journey of a blood culture. So definitely check it out if you haven't already. Go to the Febrile the Febrile Podcast, which is in all podcast platforms, and look up for that episode, the journey of a blood culture. And I talk what happens to the blood cultures when they get to the lab. So it's always nice, as I say, to connect those things, right? From you get it in the lab, you grow it, you do the testing, you report it, and then what happens after that? What does the physician do with that information? How is the pharmacy involved? So it was a great episode, and it was fun doing that episode with Sarah. I hope that at one point in time we get to do something again. I love collaborations and supporting fellow microbiology, infectious disease podcasts. There's not that many of us out there, but we are, I think, and we're doing a good job of staying motivated and sharing our information and making sure that we help out, right? So making things better by explaining this information that, as you know, it can be very complicated. So then I got to watch that episode being recorded. I got to meet Dr. Daniel Griffin, very nice. I got to meet Dr. Vincent Racanello, very nice as well. It's kind of like one of those Hollywood feelings where you get, you see this popular podcast, and then you meet the people behind it. So it's great. It's a great feeling, if you're into this, meeting some of those podcasters. So unfortunately, Dr. Dong was not there. She had a conflict, so I was hoping to meet her while I was here, but it's a very crowded place, a lot of stuff going on. So sometimes it's hard to get to see people. So maybe next time I'll get to meet her. But it was just nice, and then I got to tell them about my podcast, which this is something that you, the audience, I continue to I want to ask you, if you listen to Let's Talk Micro and you like it, please, tell your coworkers. If you're a teacher, tell your students, share the information. Sometimes, there's still a little bit of unawareness about Let's Talk Micro, and I'm trying to correct that. So definitely share information, let people know, hey, there's this podcast called Let's Talk Micro, and that way people can access it, download episodes, and get that content, and then in turn recommend it to others. So I got to tell them about my podcast, and that was really cool. So now they know, maybe one day we can do some sort of collaboration. I don't know, but it was definitely, it was a great experience. And as you know, when I was in Microbe in June, I got to watch an episode of Editors in Conversation from the ASM. That was a cool experience, which actually, that episode was with Dr. Benjamin Pinsky and Dr. Ryan Relich, which they ended up being guests on the podcast. I mean, Dr. Pinsky did the episode about viruses, and Dr. Relich did that one with him, and then he did the one with Francis Sella, which, if you haven't checked them out, please go ahead and do so. Those are the episodes of Talking Francisella with Dr. Kenneth Gavina and Dr. Ryan Relich. And then the other one is Emergent Viruses, which does a two-part episode, and thus with Dr. Benjamin Pinsky and Dr. Ryan Relich. If you haven't checked them out, please go ahead and do so. So I want to start moving on to the posters a little bit. And I want to talk about one called penicillin gradient diffusion over choline resistance and promotes unnecessary vancomycin use in Enterococcus faecalis bloodstream infections. And this is from Lindsay Donahue, who's a pharmacist from the UVA, University of Virginia Health System. And it was very interesting talking to her and seeing how, with some, they were getting some discrepancies. The physicians starting questioning the results of penicillin, and they started doing some testing, and there was a discrepancy between gradient diffusion of testing with penicillin versus broth microdilution, and they were getting resistant results with the with the gradient diffusion, with the gradient strips, and they were getting more susceptibility with the same isolates on broth microdilution. So this was a very interesting poster. And then the other one was the impact of rapid identification and resistance gene detection using an algorithm-based approach in gram-negative bacteremia. And I spoke to Jason Joanda, and this is from UPMC, which is the University of Pittsburgh Medical Center. And this was actually a recurrent theme, in one of the along the posters that I saw, and it's just so implementing, bringing rapid testing for blood cultures. And this is something that sometimes might be unaware of. I mean, if you work in a large facility, you probably have an instrument that does, like some sort of molecular testing on blood cultures. There are several manufacturers out there in the industry, but some places don't. And having that instrument that gives you that ID and that can give the provider an idea of what they're working with, it affects the treatment of the patient. So this instruments, they can detect genes. You get like your VAN-A, like your MEK-A, MEK-A for MRSA, VAN-A for VRE, for your CREs, your OXA, your VIM, your KPC, your NDM. So there's different variations out there, like I said, but they do save time. So this is something that I see a trend where more places are starting to bring this type of instruments, and that's really good because it does, they do help the patients out. And as you know, microbiology is all about time. And then the other one was from the University of Kentucky Healthcare, high concordance rates between the EPLEX BCID panels and standard identification and susceptibility methods enable utilization of results to guide rapid antimicrobial optimization. So this is a comparison using the ePlex, which is one of those systems. No relationship to the podcast, but it's a good system. I work with it. I'm familiar with it, and so once again, right, you see the theme of bringing these instruments and comparing how they compare to the traditional identification testing, which nowadays, it's mostly MALDI-TOF, maybe VITEC, Microscan. But it's a really good, reliable instrument. So that is in that abstract they were comparing how the ePlex did, and it does really well. I mean, from experience, when it calls something, it's really good, very accurate. It can identify staph, strep, some of your enterobacterales, some of your non-fermenters. So depending on the panel, right, it varies the amount of organisms that it can detect. And these systems, they all have their pros and cons. Some might have more components than others. But overall, the end result of it is just that they provide information faster, right? Rather than just waiting. You see the gram thing, you play the sample, and then you have to wait 18 to 24 hours to see what actually grew. So that's something, to think about. If you can, maybe if your institution, you should definitely start looking into bringing some of these instruments. So I have been in smaller facilities and I have seen it. So I am not sure as to how it works in as far as why one facility doesn't have it. They might be big or small. Um, so it's kind of, you get wrapped up in your bubble, right? And I've been exposed to these instruments for a while. And I mean, and granted, I do work at a very large facility, um, but I also got to spend some time at a smaller one, and there was also a system. So it's one of those things that I haven't worked in a place that where they don't have one. So once again, if you, maybe you should look into this at the end, right? It saves time, and they're very reliable and accurate. And not only they provide IDs, but they do provide information from genes that confer resistance. So, and this one was a really good favorite of mine from Emily Kelly, and this is from the California Department of Public Health and the Department of Laboratory Medicine from the University of California, San Francisco. And this was called Clinical and Epidemiologic Review of Capnocytophaga Infections Identified at a Public Health Reference Laboratory. So this is great, and this is great, and I will be talking at some point more about Capnocytophaga. We don't see a lot, right? And we know that it's it's part of some animals' flora, but it's interesting, and we have seen some cases. And we might see it in the lab every now and then, maybe not too often. We heard about this case years ago where the person got, I think the pet licked the person on the face, and then they ended up losing like some part of it. So that was definitely horrible and terrible. But overall, we don't see it much in the lab. So this was just very interesting. About talking about capnocytophaga and infections, and this is something that is not reportable to the health agencies, but according to this abstract, sepsis and other severe complications of Capnocytophaga species are more common in immunocompromised patients, particularly those with asplenia or heavy alcohol use. So they collected some data, and it was fun. It's always interesting learning. It's not about learning. I mean, those of you that work in micro, you're familiar with Capnocytophaga, but seeing it and in a poster, right, where a lot of times, your enterobacterialis, your non-fermenters, they take a huge chunk of the spotlight, right? So it's always interesting seeing something else on one of these presentations. So I really liked it, and it was really fun talking to Emily about this, and it was a great poster. So I don't know if you're checking out this episode, Emily, thank you. It's just, I think this is one of the ones that I enjoy the most as I was walking around. There was another one, do patients with candidemia need an ophthalmology examination? This is also very interesting. This is something that I didn't know. This is from the University of Minnesota. So that's something definitely worth looking into, and patients with candidemia and having eye problems. Maybe you were familiar with this or not, but it was just something very interesting to learn while checking out this poster. So just to kind of start wrapping it up a little bit, many great posters. So as I said, if you register, check these out. They're really worth looking into. But I'm just gonna mention one more and then continue moving on. So there was this one caught my eye, and I saw this one today, and this was the antagonistic activity of lactic casibacillus rhamnosus against carbapenem-resistant Acinetobacter baumannii. So it was very interesting, and I was talking to the person that did the study and that was involved in it. And this organism, it's using probiotics, and they were doing like a co-culture, and they saw that this organism, it was actually reducing the growth of Acinetobacter baumannii. So it's something that they are looking into, and it's very interesting. And maybe this could be an alternative therapy. But you could see, and they show me from the electron microscope the images, and you could see, like, I guess, Acinetobacter was showing signs of stress. It was just like changing the shape, and it was definitely showing signs of stress as in the vicinity of this organism, which correlates with the fact that it reduces the growth. So as you know, Acinetobacter baumannii, you're getting some strains that are very resistant out there, and then we're coming out with some antimicrobials for it. Well, as one of them, as you know, Sulbactam, Durlobactam that you hear out there. So this type of studies, they're very interesting. They could find a way that maybe somehow, right, if you have an infection with this organism and give the patient some sort of probiotic, and if this could work, this would be definitely a nice alternative to antibiotics, or at the very least complement it. So it was just very interesting. So the one thing that I just want to, so many great posters out there, as I have said, but one thing that I saw was, and as I was walking around at some of the posters, I saw a theme. So and it was about sometimes like pharmacy, getting involved in projects with education to physicians, and they were talking about the guidelines for the IDSA guidelines for UTIs and immunocompromised patients, and overall they were showing data that even though some patients, they were first of all, they were explaining what they consider, the criteria for consider a urine positive, right, for culture. And so the criteria to consider an UTI in a patient. And they were talking about that, and sometimes they say patients, even they don't show any symptoms, they still get treated, and that's something that they try to reduce sometimes, because it's right. We continue prescribing antibiotics and using antibiotics and all this accessibility, and sometimes patients don't even finish them; they share them with others. And it's definitely a very real issue that we are seeing all this resistance out there, and AMR is definitely something very serious. So anything that we can do to reduce that, and I think that this is a great effort, to seeing how with some education and maybe sometimes getting providers to not prescribe as much antibiotics as sometimes they do. And I'm not a physician, so I am not in their shoes. So this is from my point of view and from the pharmacy, but it is good to see people taking steps, right, to reduce, the amount of AMR that's out there. So it takes a village to do this. It takes everyone in this profession, from pharmacy to doctors to a lab. So everyone has a role to play, and we all have to play as a team to make sure that we work on this issue. So that was a recurrent theme. So from ID Week, those are the two themes that I saw a lot. Definitely a lot of studies comparing antibiotics, but those two about implementation of rapid testing for blood cultures and the effect of that, and then UTI guidelines and prescribing antibiotics. A lot of good posters. and a lot of good people. And I'm definitely going to be reaching out to some to see if they are interested in doing an episode. I already have spoken to some and they are. So stay tuned. But overall, I go back to Orlando with with such a high in the sense of my nerd gauge has been it's all the way up. So it's great, and now it's just great doing talking to you and sharing my experiences. So next year, if you have the budget, the time, definitely check out ASM. And if you're in the lab, like me, like I'm an MLS medical lab scientist, and I exhort you to go and check out ID Week as well if you can. They do have some great topics, and a lot of them they're definitely right in our alley of of lab testing and organisms and antibiotics. So check it out. Check them out if you can. Um, Something that we maybe everyone needs to work on is maybe trying to make them a little more affordable. That's the thing. I mean, not everyone can afford to hotel, um, conference, plane tickets, so it adds up a lot. So maybe if there could be some ways where maybe like provide some sort of a like some fund for where people can apply and perhaps get grants to attend it, that would be great to increase the attendance of them. I know that with ID Week, yeah, it's a little more in the physicians, the pharmacist alley, whereas microbe is more in the microbiologist alley. But even with ASM, some people might be unaware of it, and if they are, they can't afford it sometimes. So that's something that needs to be worked up on, because everyone can benefit from attending this conferences. So, Dr. Gauthier, if you're listening to it, thank you for those few minutes. That was great. And for the audience, as always, thank you for your support. Thank you for listening. If you are listening in YouTube Live, uh, please have patience and bear with me. This is the first time trying it, so we'll continue working on that. But once I edit the episode, I will go ahead and submit the completed version to YouTube as well after I publish it on the podcast network first. But everyone, take care. It's always, as always, I love talking to you. So continue bringing that passion to what you do. It's so important. You do such great work. So, as always, stay motivated, stay safe, and of course, continue talking micro. This has been a live presentation from Boston at ID Week, the Boston Convention and Exhibition Center. Thank you, Boston, for the hospitality. Thank you, everyone. And until the next time. Thank you, Boston, for the hospitality. Thank you, everyone. And until the next time.